Have you ever wondered if those vitamin supplements you're taking every day might actually be doing more harm than good? That multivitamin sitting on your bathroom counter, the one your doctor, or maybe even your children insist you take. What if I told you certain vitamins in that bottle might be increasing your cancer risk? It sounds almost unbelievable, doesn't it? Like something that can't possibly be true. After all, we've been told our entire lives that vitamins are essential for our health, especially as we age. But here's the shocking truth that most doctors don't have time to explain during your brief 15-minute appointments. Two common vitamins that millions of seniors take daily have been linked to increased cancer risk in multiple scientific studies. I've seen this firsthand with patients like Robert, a 75-year-old who religiously took his high-dose supplements for years, only to discover they may have contributed to his aggressive prostate cancer diagnosis. Today, I'm sharing the research that most supplement companies don't want you to know, information that could literally save your life or the life of someone you love. Stay with me until the end, because I'll also reveal the safer alternatives that can give you the nutrients you need without the hidden dangers. Hey there, I'm so glad you're watching today. Before we dive deeper into this critical information, I'd love to know where you're watching from. Drop your location in the comments below so I can get to know our community better. And if you have any questions about supplements or cancer prevention in seniors, please don't hesitate to ask. I read every comment. If you're new here and want to stay informed about the latest research on cancer prevention and treatment for older adults, be sure to hit that subscribe button and turn on notifications so you never miss potentially life-saving information. Let me be completely transparent with you right from the start. What I'm about to share might be unsettling, especially if you've been taking supplements for years believing they were helping you stay healthy. The relationship between vitamins and cancer is complex, and the research is still evolving. But there's enough evidence now for doctors and researchers to raise serious concerns about two specific vitamins that many seniors take daily, often in doses far higher than what our bodies actually need. These findings aren't making headlines because, frankly, there's a multi-billion-dollar supplement industry that profits from our belief that more vitamins equal better health. That's simply not always true, and for certain vitamins, the opposite may be happening in your body right now. I need to pause for a moment here because I want to ask you something important. What's your experience with vitamin supplements? Have you ever questioned whether they're actually beneficial or wondered about side effects? You know, many people feel alone in their health journeys, especially when facing complex decisions about cancer prevention or treatment. There's so much conflicting information out there, and it can feel overwhelming to figure out what's right for you or your loved one. But I want you to know that your experiences and questions are valued here. This is a safe space where we can have honest conversations about difficult topics. If you'd like to share, you can simply copy "My experience with supplements has been," and complete it with your thoughts. Even just a few words can make a difference. Your comment might be exactly what someone else needs to read today to feel less confused or isolated in their health decisions. Every time you share your experience, you're not only helping me create more relevant content for our community, but you're also potentially helping countless others who are silently facing the same questions and concerns. Now let's dive into the first vitamin that has raised serious concerns among cancer researchers. Vitamin E supplements, particularly high-dose alpha tocopherol supplements, have been shown in several large-scale studies to potentially increase cancer risk in certain populations. This might come as a shock because vitamin E has been marketed for decades as an antioxidant superhero that fights free radicals and prevents cellular damage. But here's what the research actually shows. The landmark SELECT trial, Selenium and Vitamin E Cancer Prevention Trial, followed over 35,000 men for more than a decade and found that those taking 400 IU of vitamin E daily had a 17% increased risk of prostate cancer compared to those taking a placebo. That's not a small number. We're talking about a significant increase in risk from a supplement many doctors still recommend to their older patients. But why would vitamin E, something we need for our health, potentially trigger cancer in older adults? The mechanism is fascinating but concerning. At high doses, vitamin E's antioxidant properties can actually flip and become pro-oxidant, causing the very cellular damage it's supposed to prevent. Think of it like firefighters who normally put out fires, but if you send too many to one small fire, they might accidentally cause more damage than the fire itself. Our bodies maintain a delicate balance of oxidants and antioxidants, and flooding your system with high-dose supplements disrupts this balance. In older adults, this disruption can be particularly problematic because our cellular repair mechanisms become less efficient with age. What makes this even more concerning is that many seniors are taking much higher doses than the recommended daily allowance of vitamin E, which is just 15 milligrams or about 22 IU per day. The supplements on store shelves often contain 400 IU or more. That's 18 times what your body actually needs. And many multivitamins marketed specifically to seniors contain elevated levels as well. Have you checked the label on your supplement bottle? Lately, you might be surprised at what you find. The danger doesn't stop at prostate cancer. Other studies have found connections between high-dose vitamin E supplementation and increased risks of hemorrhagic stroke. The Miller study, published in the Journal of the American Medical Association, analyzed 19 clinical trials involving more than 135,000 participants and found that high-dose vitamin E supplementation increased all-cause mortality. Let that sink in for a moment. In some cases, these supplements weren't just failing to help, they were associated with earlier death. Now, does this mean you should avoid vitamin E entirely? Absolutely not. Vitamin E from food sources is both safe and beneficial. Foods like sunflower seeds, almonds, spinach, and avocados provide natural vitamin E in forms that your body can use appropriately. The difference between food-derived vitamins and synthetic supplements is crucial to understand. When you get vitamin E from whole foods, you're also getting hundreds of other phytochemicals and nutrients that work synergistically. These natural packages come with built-in instructions for your body on how to use them properly. Supplements, on the other hand, are isolated compounds that flood your system all at once. For older adults specifically, the risks of high-dose vitamin E may outweigh the benefits. Our metabolism changes as we age, and our bodies process supplements differently than they did when we were younger. If you're over 65, it's particularly important to discuss any supplements with your doctor and to be skeptical of marketing claims about anti-aging or cancer prevention from vitamin E supplements. Let's move on to the second concerning vitamin, vitamin A, particularly in its preformed version, retinol, and through beta-carotene supplements. Again, we have a vitamin that's essential for health. Vitamin A supports vision, immune function, and cell growth. But in supplement form, especially for older adults, it can potentially increase cancer risk under certain conditions. The most alarming evidence comes from studies of smokers and former smokers taking beta-carotene supplements. The CARET study, beta-carotene and retinol efficacy trial, was actually stopped early when researchers discovered that participants taking beta-carotene and vitamin A supplements had a 28% higher incidence of lung cancer and a 17% higher rate of death compared to those taking a placebo. The ATBC study found similar results, with smokers taking beta-carotene showing an 18% increase in lung cancer incidence. While these studies focus primarily on current and former smokers, they raise important questions for all older adults. Many seniors were former smokers, even if they quit decades ago. And the biological mechanisms that make these supplements risky don't simply disappear once you've quit smoking. The interaction between the lingering effects of smoke exposure and high-dose vitamin A supplementation can create the perfect storm for cellular damage. Even for non-smokers, excessive vitamin A supplementation comes with risks. Unlike water-soluble vitamins that your body can easily excrete when levels get too high, vitamin A is fat-soluble. This means it accumulates in your body's fatty tissues and liver, potentially reaching toxic levels over time. In older adults, this accumulation happens more readily because kidney and liver function naturally decline with age, making it harder for your body to process and clear excess vitamins. The symptoms of vitamin A toxicity can be subtle at first: headaches, dry skin, or joint pain that might be attributed to normal aging. But over time, excessive vitamin A can lead to more serious problems, including liver damage. And here's where the cancer connection becomes concerning. Chronic liver inflammation and damage are risk factors for liver cancer. So while the supplement itself might not directly cause cancer, the long-term organ stress it creates might set the stage for cancer development. What's particularly troubling is how easy it is to exceed the upper limit for vitamin A without realizing it. The recommended daily intake for adults is 700 and 900 mcg for women and men respectively, with an upper limit of 3000 mcg, but many multivitamins contain 500 tanton mcg or more of preformed vitamin A, retinol. Add to that fortified foods like cereals and dairy products, plus any separate vitamin A or beta-carotene supplements, and you could easily be consuming potentially harmful levels daily. For older adults, this risk is compounded by the fact that vitamin A is stored more readily and cleared more slowly as we age. What might have been a safe supplementation level in your 40s or 50s could potentially become problematic in your 70s or 80s. And if you're taking certain medications common among seniors, like statins for cholesterol or certain antibiotics, the interactions with high-dose vitamin A can further increase risks. So what's the solution? First, get your vitamin A primarily from food sources. Orange and yellow vegetables like carrots, sweet potatoes, and butternut squash are excellent sources of beta-carotene, which your body converts to vitamin A only as needed, a natural safety mechanism that prevents toxicity. Dark leafy greens, bell peppers, and tropical fruits also provide carotenoids that support your health without the risks of isolated supplements. If you do take a multivitamin, look for one that provides no more than 100% of the daily value for vitamin A, and preferably one where the majority comes from beta-carotene rather than preformed vitamin A, retinol. And most importantly, talk to your healthcare provider about your specific needs and risks. Blood tests can determine if you're deficient in certain vitamins, making blanket supplementation unnecessary and potentially harmful. Let's take a step back and look at the bigger picture of supplementation for older adults. There's a common misconception that seniors automatically need more vitamins as they age. While it's true that certain nutritional needs change and some vitamins may become more difficult to absorb, the solution isn't always supplementation. In fact, focusing on nutrient-dense whole foods becomes even more important with age. As we get older, our caloric needs typically decrease, but our nutrient needs remain similar or even increase. This creates what nutritionists call nutrient density pressure, the need to get more nutritional bang for your caloric buck. Supplements might seem like an easy solution, but they miss a crucial component of nutrition, the food matrix in which nutrients naturally occur. When you eat a piece of fruit or a serving of vegetables, you're not just getting isolated vitamins and minerals. You're getting fiber, water, enzymes, and thousands of phytochemicals that science is only beginning to understand. These components work together synergistically in ways that isolated supplements simply cannot replicate. For example, the vitamin C in an orange comes packaged with flavonoids that enhance its absorption and utilization in your body. For cancer prevention specifically, this food matrix effect is particularly important. Many studies showing cancer protective benefits from fruits and vegetables haven't been able to reproduce the same effects when the isolated nutrients are given as supplements. This suggests it's the complete package, the entire food, that provides the benefit, not just the individual vitamins. This brings us to a critical point about cancer prevention in older adults. Supplementation should complement, not replace, a nutrient-rich diet. If you're concerned about getting enough nutrients as you age, consider working with a registered dietitian who specializes in geriatric nutrition. They can help identify any true deficiencies and develop strategies to address them through food first, with targeted supplementation only when necessary. There are some exceptions where supplements are genuinely beneficial for seniors. Vitamin B12, for instance, becomes more difficult to absorb as we age due to decreased stomach acid production. Many older adults benefit from B12 supplementation. Vitamin D and calcium supplements may be recommended for bone health, particularly for those with limited sun exposure or dairy intake. But even these should be taken thoughtfully with proper dosing and regular monitoring. The problem arises when we take a more is better approach to vitamins, assuming that if some is good, more must be better. This simply isn't how our bodies work, especially as we age. Our bodies maintain carefully balanced systems, and flooding them with high doses of isolated nutrients can disrupt these balances in ways that potentially promote cancer development rather than prevent it. Let's talk about what this means practically for you or your loved ones. First, if you're currently taking high-dose vitamin E or vitamin A supplements, don't panic. The increased risks we're discussing develop over time, not overnight, but do make an appointment with your healthcare provider to discuss your supplementation routine in light of this information. Second, be skeptical of marketing claims. The supplement industry is largely unregulated, and companies can make sweeping claims about the benefits of their products without substantiating them with rigorous research. When you see a supplement marketed specifically for cancer prevention or immune boosting for seniors, approach it with healthy skepticism. Third, remember that cancer prevention is multifaceted. No single vitamin or supplement can prevent cancer, and focusing too narrowly on supplementation might distract from more evidence-based prevention strategies like regular screening, physical activity, maintaining a healthy weight, limiting alcohol consumption, and not smoking. Fourth, consider getting a nutrient panel done through your doctor. This blood test can identify any true deficiencies that might need addressing. It's much more precise than guessing which supplements you might need based on age alone. And finally, focus on building a colorful, varied diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. This approach provides a wide spectrum of nutrients in their natural forms and ratios, exactly as your body has evolved to use them. I want to emphasize that the goal here isn't to frighten you away from all supplements. The goal is to promote informed, evidence-based decisions about your health. Some supplements are beneficial for certain people under specific circumstances. The key is determining which ones are right for you based on your individual health profile, not based on marketing claims or general assumptions about aging. For those of you caring for older parents or loved ones, this information is particularly important. Often, seniors take supplements recommended by well-meaning family members who want to help them stay healthy. Having a conversation about the potential risks of certain high-dose vitamins might be challenging, but it's an important part of comprehensive care. If you're helping manage medications and supplements for an older adult, consider scheduling a medication review with their healthcare provider or a pharmacist. This review should include all supplements, not just prescription medications. Many healthcare providers don't routinely ask about supplements unless prompted, so being proactive about this conversation is essential. Remember, too, that nutritional needs can change during cancer treatment. If you or a loved one is currently undergoing treatment for cancer, the guidelines around supplementation may be different. Some treatments deplete certain nutrients, while others might interact negatively with certain supplements. Always consult with your oncology team before starting or continuing any supplement regimen during cancer treatment. I also want to acknowledge that changing long-held health habits can be challenging. If you've been taking certain supplements for decades because you believed they were keeping you healthy, it might be difficult to accept new information that contradicts this belief. That's completely understandable. Our health routines become part of our identities, and changing them requires not just new information, but emotional adjustment as well. If you're feeling conflicted about this information, I encourage you to seek multiple perspectives. Talk to different healthcare providers, read the research studies I've mentioned, and take time to process this new information. Health decisions shouldn't be made hastily or based on fear, but rather on a thoughtful evaluation of the evidence as it applies to your specific situation. As we wrap up today's discussion, I want to leave you with some positive, actionable steps you can take to reduce cancer risk as you age, steps that don't involve potentially risky supplementation. First, prioritize regular cancer screenings appropriate for your age, gender, and risk factors. Early detection remains one of our most powerful tools against cancer. Colonoscopies, mammograms, skin checks, prostate exams, and lung scans for former smokers can all catch cancer at more treatable stages. Second, stay physically active in whatever way works for your body. You don't need intense exercise to reduce cancer risk. Even regular walking has been shown to lower the risk of several common cancers. Aim for 30 minutes of movement most days of the week. Third, maintain social connections. Isolation and loneliness have been linked to increased inflammation and reduced immune function, both of which can increase cancer risk. Regular, meaningful interaction with others is not just good for your emotional health, but your physical health as well. Fourth, manage stress through whatever techniques work for you. Meditation, deep breathing, prayer, gentle yoga, or time in nature. Chronic stress increases inflammation and can suppress immune function, potentially creating conditions that favor cancer development. And finally, focus on joy and purpose. Research increasingly shows that having meaning and purpose in life is associated with lower levels of inflammatory markers and better overall health outcomes. Whether it's volunteering, pursuing a hobby, mentoring younger generations, or simply cultivating gratitude, finding joy and meaning in your daily life is powerful preventive medicine. Thank you so much for staying with me through this important conversation. If you found this information valuable, please give this video a thumbs up and share it with someone who might benefit from it. Your engagement helps this vital health information reach more people who need it. If you haven't already, please subscribe to our channel and turn on notifications so you never miss our weekly videos on cancer, prevention, treatment options, and quality of life for older adults. Our community is growing, and we're committed to providing evidence-based information that empowers you to make the best health decisions for yourself and your loved ones. Remember, knowledge is power when it comes to cancer prevention. While today's topic might have been concerning, being informed about potential risks is the first step toward making choices that truly support your long-term health. You have more control over your cancer risk than you might realize, and every positive choice you make matters. I believe in your ability to use this information wisely, and I'm here to support you every step of the way. Until next time, take good care of yourself. You deserve nothing less.